Good afternoon. My name's Christina Graham, and I'm a registered dietitian, licensed dietitian, and a certified diabetes care and education specialist here at Titus Regional Medical Center. I am thankful to have the opportunity to share with my diabetes support group and with the public a little information that is pertinent to diabetes management, remission, and even diabetes prevention. I hope this information will be helpful to everybody, whether they have diabetes or they're looking to protect themselves or prevent diabetes. So just a little background information about diabetes. It is a group of metabolic diseases characterized by high blood sugars. The medical term for high blood sugar is hyperglycemia. These result from defects in the body's insulin secretion, insulin action, or both. Chronic high blood sugars associated with uncontrolled diabetes leads to many serious consequences and long-term health problems. These can include things like damage to the eyes, the kidneys, the nerve, the heart, and blood vessels. So in our country, there are currently 34 million Americans, which is 1 in every 10 Americans who have diabetes, and 88 million Americans, and that's adult Americans, who have prediabetes, the precursor to type 2 diabetes. That's approximately 1 in every 3. So every year, just over 1.5 million people are newly diagnosed with this disease. And certainly the diabetes cases are more prevalent currently in people that are Black or of Hispanic origin, and a little less common in those that are Asian or Caucasian. Who's at risk for diabetes? Well, many people, certainly, and those that are over the age of 45, those of that heritage that I shared with you just a moment ago, people that have a personal connection, especially a first, relative that, like a parent, a brother, or sister who also has diabetes, people that are overweight and physically inactive, those that have high blood pressure or take a medicine for high blood pressure, and those with a low good cholesterol called HDL cholesterol, or a high triglyceride level, which triglycerides are a blood fat. Those that have had diabetes in a pregnancy, or those that have been diagnosed with polycystic ovary syndrome. So some of these risk factors are out of our control. If we have a gene for diabetes that we inherited from family, that's out of our control, for example. Or being over the age of 45, we're all getting a year older each year, right? So those are non-modifiable risk factors. However, there are a number of these risk factors on this list that we can really work to modify and reduce. And that's a key in diabetes prevention. So there is some good news on this list. These are some of the diagnostic criteria for diabetes. There is a blood test, also called the estimated average glucose, or EAG, or another name for it is the hemoglobin A1C. And this blood test is being used pretty widely in the diagnosis of prediabetes and diabetes, because it's a test that can be taken any time of day and you don't have to fast for it. This blood test, if your result comes back greater to or equal than 6.5%, which is essentially a 2 to 3 month average sugar of approximately 140, that is a diagnosis point for diabetes. Also, if your fasting plasma glucose, if you've not eaten for at least 8 hours or more, if your fasting plasma glucose is greater than or equal to 126, if you've drunk 75 grams of carbohydrate, and 2 hours later, they test your plasma glucose and it's greater than 200. Or if you go into your doctor saying, I've got some symptoms that are concerning me, doctor, like maybe I've been thirsty more or I'm tired more. Those are some classic symptoms of diabetes: blurred vision, catching a lot of infections, from respiratory infections to even urinary tract infections. If you say those comments to your doctor and they do a plasma glucose which results greater than 200, that would suggest diabetes. Generally, the American Diabetes Association does recommend that they do a second check to confirm the results unless there have been signs or symptoms of high blood sugar like the ones that I mentioned to you. So this chart has a lot of information to it, but is really, really powerful. The first thing I want to explain about this is that many people that I speak with, they think that the diabetes started just short of them having their blood sugar testing. But this chart, based on research, shows that diabetes actually starts as many as 10 years prior to the diagnosis of diabetes. And it starts in that area we call prediabetes, which is defined as an A1C between 5.7 and 6.4. And it's associated with fasting blood sugars between 100 and 125. So prediabetes actually starts as many as 5 to 10 years before the blood sugars go high enough for the doctor to say, okay, here we have diabetes. So the other thing that we can pull from this chart, you can see, is that the post-meal blood sugar rise actually starts 5 years before a diagnosis of diabetes. And those elevated blood sugars are linked to macrovascular complications and microvascular complications. Those are serious complications like heart problems, eye problems, kidney problems, and even nerve problems. And they start years before the actual diagnosis of diabetes. So certainly when somebody's diagnosed with diabetes, you would hope they would start making some dietary changes. Maybe they would try exercising a little more regularly. Their doctor might start with type 2 diabetes and oral diabetes medication. And you can see that insulin secretion, when somebody has type 2 diabetes, that's the amount of insulin that their pancreas is releasing, that as early as 5 years after the diagnosis of type 2 diabetes, already it's starting to decline. And by 10 to 15 years, that insulin secretion decrease may ultimately lead that person to be hearing from their doctor that they need insulin. So they need to be starting to take some insulin. So this is the natural progression of the disease of type 2 diabetes. And this chart just has a lot of information to it, but it really breaks it down nicely, the concerns that we have when somebody develops type 2 diabetes. This chart simply shows that before the A1C gets to 6.5%, which is the diagnosis point for diabetes, that the post-meal blood sugar readings are already going quite elevated. You can see in an A1C of 6, which is in the pre-diabetes range, that the post-meal blood sugars might be up into the 180s and near 200 readings, and that's quite elevated. And so that's a particular concern. The post-meal blood sugar readings actually rise before the fasting, which is the first thing in the morning time blood sugar reading rises. And eventually they both rise. And the higher the A1C, the more they rise. But they rise well before the diagnosis point currently for type 2 diabetes. So if you have been diagnosed, if you're one of the 34 million Americans that has a type of diabetes, whether it be type 1, which is an autoimmune condition treatable only by starting insulin and then lifestyle, or type 2, the more common type of diabetes that I'm really going to be referring to more commonly in this presentation, the diabetes management steps really are very similar. We should have a home blood glucose meter or a continuous glucose monitor. The more you know where your blood sugar stands, the better you can address those blood sugars. And let me just say, elevated blood sugar does not always have symptoms. And generally, it is silent. It has no symptoms at all. So a home blood glucose meter is literally key to knowing where you stand with your diabetes management and whether your blood sugars are where they need to be. It is key. Also, certainly healthy meal planning practices are very important to diabetes management. That might be trying to eat more baked and grilled foods. It might be watching your portion control, especially when it comes to high carbohydrate foods. That might be limiting sweets and things that are made with sugars that digest very quickly, like dessert items or sweet drinks or even fruit juice. Physical activity is definitely a management step for diabetes, and it's key along the way. The current recommendations are to try to get about 150 minutes of physical activity weekly, but that can be broken up into little manageable pieces, and that physical activity can range from chair exercises to walking to swimming. There's no one type of exercise that works best for diabetes management. The key seems to be doing exercise is generally wonderful and definitely a management step. Taking a diabetes medication consistently and correctly, timing it right and being faithful to it, that's another step to diabetes management. Not everybody's diabetes is going to be managed with lifestyle alone. Many people, especially people having diabetes for several years, are going to need another tool like a diabetes medication, and they're going to need to take it correctly, time it correctly, and be consistent with it. We know that adequate sleep and quality sleep is also another management step to diabetes. Untreated sleep apnea, for example, is a stressor, and stressors generally cause worsening blood sugar control. So getting good sleep at night is also key. And finally, keeping regular appointments with your healthcare provider. They're a key member of your diabetes management team, and you need their guidance on a regular basis. So for a few slides, I'm going to talk about diabetes remission. This is a topic that's really interesting. It's rather fascinating. And in the last 2 years, there's been research that's been quite exciting in this area of diabetes remission. So what is diabetes remission? And diabetes remission is getting the diabetes into good control. Example might be an A1C less than 6.5 without the need for a diabetes medication. So there was a trial that was done called the Direct Diabetes Remission Trial. This trial was done in Scotland and the United Kingdom. And the trial was done in 49 physician offices. In this trial, they looked to see if through dietary and lifestyle habits, they could put type 2 diabetes into remission. Now, one of the theories for why they felt this might be possible is the twin cycle hypothesis. And this is related to the fat that builds up in our liver when we gain weight. Not only does that fat build up in our liver, but it also builds in our pancreas, which is the place where insulin, the hormone that lowers blood sugar, is produced. The theory and the hypothesis is that as we build fat in these two organs, they impair the insulin production of the person's body. And by helping somebody lose weight, therefore lose fat from these two organs, the hypothesis was that it would help us restore normal insulin production. This trial lasted 2 years and certainly focused on the reduction in A1C and or weight loss, as it would be likely to lower the risk for long-term complications of diabetes, lower insurance costs, increase well-being, and no longer have to take medications which is also important. If you're able to decrease your diabetes medications, that's a personal savings, perhaps. And the other thing is all medicines may have some side effects. That was another benefit of lowering the medicine. So the end goal here may be to take somebody off of a diabetes medication. However, I would just like to be clear, in this trial, they worked with people who had had type 2 diabetes for no more than 6 years. The longer that somebody has had diabetes, the less insulin their pancreas may secrete. That's part of the progression of the diabetes. So if somebody has had type 2 diabetes for more than 6 years, they still may need some diabetes medication. And this trial that I'm sharing is by no means to encourage you to stop taking your medicine. It's meant to be information that I hope will encourage you to consider lifestyle changes and a discussion with your doctor about your medications. So diabetes remission has been shown to be due to the normalization of high fat levels inside the liver and the pancreas. And that's only possible through weight loss. And three ways that this weight loss can happen are a low carbohydrate diet, a low calorie diet, and possibly bariatric surgery. In the direct trials, they used a low calorie diet. So the direct trials, what they tested was restricting calories. And in the trial, they actually restricted the calories to about 850 per day. And they did that for 3 months. And then they reintroduced a few more foods into their meal plan. There were monthly check-ins, there was a lot of lab monitoring, and there was an encouragement to increase to near daily physical activity. And this is what this trial found. The trial found after 1 year that 46% of the 149 participants using the low-calorie diet had achieved remission of their diabetes. Again, that was defined as an A1C less than 6.5% without a diabetes medication. The average baseline weight, so at the start of the trial, the average weight of the participants was 223 pounds, or 101 kilos. Among the people who gained weight during the trial, 0 had achieved remission. However, those who lost between 0 and 11 pounds, 7% achieved diabetes remission. Those that lost 11 to 22 pounds, 34%, or just over a third, achieved diabetes remission. Those losing 22 to 33 pounds, 57% achieved remission. And those that lost 33 pounds or more, 86% achieved diabetes remission. More exciting than this is at 2 years, those that achieved remission, 70% of them had maintained the remission of their diabetes. So the average weight loss at 2 years was approximately 17 pounds. And that's saying something. Some had regained some of the weight, but had still managed to keep their blood sugars and their A1C at a level where medication had not been restarted. And ultimately, what you can see in these results is there's a direct correlation between the amount of weight that you lose, if, again, you're overweight, and your A1C and your diabetes remission. So all very powerful findings from the direct trials. The longer you've had type 2 diabetes, again, the more difficult it might be to reach this place of diabetes remission. As I mentioned, over time, this condition does lead to a decrease of insulin production by the pancreas and some burnout of the cells that produce insulin. So after a certain duration, it may be more important to try to improve insulin production certainly you may still need diabetes medications to reach the A1Cs below 7% that ADA recommends. But complete remission might not be realistic or very possible. I would just like to share a little information about diabetes prevention, and that is that probably more of you do not have diabetes. However, we're all possible candidates for diabetes. We're all at risk. We're all getting older each day. Many of us may have family and connections to diabetes, and certainly we might have abnormal lipids like our cholesterol or triglycerides. So we're all at risk for diabetes, and I want to just share a little information about how we can prevent it or even delay the diabetes development. So we do know gradual weight loss, if somebody is overweight, is really key to prevention of diabetes. And on a positive side, any weight loss helps. So the more weight loss, certainly the more powerful. However, studies have found even losing 5 to 10% of the excess can make a big difference to reducing risk of diabetes. Eating healthy, and that involves avoiding or limiting high sugar and high carbohydrate drinks like sodas, regular sodas, and sweet coffee drinks, even fruit drinks, fruit punch, or even all natural juice. That's also key to reducing the risk for diabetes. Trying to eat a little lower calorie by choosing foods that have been baked, grilled, broiled, or boiled more often than fried. That can be valuable. And there is just a lot of solid research on plant-based eating and trying to eat more vegetables, more whole grains, and certainly fruit. The vitamins and minerals and fiber that these provide have many health benefits beyond blood sugar benefits. They certainly lower blood sugar, but they also may help lower your cholesterol and triglycerides as well. Finally, increasing our physical activity to a minimum of 150 minutes per week is also a good step to prevention. Some diabetes prevention trials found that 150 minutes a week could lower the risk for type 2 diabetes as much as 67%. So this is not just about diet. Physical activity is a very important step to prevention. I would just like to share that today it is the third Tuesday of the month, and that is our usual day to have an in-person diabetes support group. I'm thankful for this opportunity that marketing has allowed for me to come and do that support group this month in a different way. Certainly everybody's having to figure out new and different ways in the midst of the COVID-19 epidemic. So I'm thankful for this opportunity to come and share some information. You may have sent some questions, and I have a few questions in front of me that I will look at with you and try to respond to. If you have questions even several hours after this session, I will try to respond to those questions within the next 24 hours. And I do appreciate your interest and your questions a great deal. So be looking for, at least the time being, for our support group to be just a little different, and that meaning it will probably be virtual for the time being. We also have an American Diabetes Association recognized education center here at Titus Regional Medical Center. That recognition ultimately means that we're offering the highest quality of diabetes education services. Our diabetes education offices and our outpatient nutrition counseling offices are currently housed at the new Family Care Center on Harts Bluff Road. That's at 2320 Harts Bluff Road here in Mount Pleasant. If you have any need for my services, I would encourage you to reach out. One way is by calling me, and the office number is 903-577-2800. 6099. I can certainly give you guidance on how we can establish some care and provide the education that you need. So I'm just going to share a couple of responses to some questions that I've received. The first question is high cholesterol a factor in the increased risk for type 2 diabetes? Research finds that it seems to be more low HDL than high cholesterol in general, but it is a factor, certainly. The research finds a low good cholesterol and a very high triglyceride level. The triglyceride level may be a precursor to the elevated blood sugar. And ultimately, let me just share that triglycerides are a fat made from sugar, part sugar. So if your blood sugar is elevating, your body will actually turn that sugar into fat and try to store it in a way of trying to lower the blood sugar. And you may have elevated triglycerides several years before your A1C elevates. And that ultimately is your body kind of in the pre-diabetes phase. So triglycerides being elevated is absolutely a warning sign that you might be on the way to diabetes. So I would also like to answer the question of how do I feel about metformin. So first, I would just say I'm not a medical doctor. I'm not a physician. I'm a registered dietitian. But I see the commercials on TV about metformin. And I will say this is a diabetes medication that has been used for many, many years. I have not seen that the regulatory agencies have seen enough evidence that there are risks to using metformin. But I can tell you that there's a lot of research that shows metformin is helpful in not only managing type 2 diabetes, but it's also been shown helpful in the prevention of diabetes. So what metformin does is it reduces your own body's sugar production by the liver. We actually do make some sugar inside our body. In times, especially when we're not eating, our liver will produce sugar to give our body some fuel because our body, even though we're not eating, still needs some energy. And when somebody is transitioning into prediabetes and diabetes, their liver may be producing some sugar, dumping it into the bloodstream, but that pancreas may not be responding with enough insulin, so the blood sugar level ultimately goes high because the sugar doesn't get it into the muscles. So what metformin does is it does lower blood sugar by decreasing the amount of sugar that your own body produces. It can really help lower the fasting blood sugar when somebody's fasting blood sugar is too elevated. And it might have some side benefits like helping to modestly reduce cholesterol. And it's weight neutral, so it doesn't tend to make people more hungry or increase the risk for weight gain, which is another positive to metformin. On the other side, metformin does have some GI side effects. Those sometimes improve after a couple weeks of taking this medication, but if they don't improve, you really do need to talk to your doctor about them. Also, if somebody has a high blood creatinine level, that's a kidney function test. There's a certain cutoff, usually of about 1.3 milligrams per deciliter on the creatinine, where this medication may no longer be a good choice. The medication is not thought to cause the kidney concern. Uncontrolled diabetes may be the cause of the kidney concern. So, but ultimately, there are some situations where your doctor may say it's better now for me to take you off of this medication. So, those are the questions that I'm going to answer for you today. And I do thank you for your time and your attention this afternoon. Absolutely don't hesitate to reach out to me at my office by certainly calling 903-577-6099. If you want to leave any further questions also on this post, I will be watching for those and we will be responding again within 24 hours. I wish you a very good rest of your day.